I cannot see myself. I'm right here, but I cannot see myself. I'm surprised. What's going on? For some reason, I cannot see myself. So I need to do these settings again. And I don't want to end this because the moment I end it, I know y'all cannot see me. I know that because I cannot see myself. So just give me some few minutes to fix this thing. Microphone, I wonder if it's working. Hi guys, just give me a minute to fix this. Go. Good. It's better now. Good. Yes, guys. Let me know if you can hear me. I'll be glad if you can just type yes. You can just type yes in the comments for me to see if just to know if you all can hear me. Um, if you can hear me, type yes for me. Yeah. To make this. If you can hear me, type yes in the comments for me, please. Um, so I'm just waiting for a few people to join. Yeah, it's Sunday here. I'm just waiting for a few more people to join. Um, okay, we have somebody. Um, there we go. Hello, you're welcome to join me. Hello, good morning.
Hello,
Good morning.
please can you hear me?
Yes, I can hear you.
Okay. Good afternoon, my side.
Hey, good afternoon. Yeah, it's morning on my side here. How are you doing today?
Um, how are you?
Yeah, I'm doing all right, bye. Um, yes, you are welcome to join. May I know where you're from?
I'm from Ghana.
May I know where you're speaking from if you don't mind?
I said I'm from Ghana.
Okay, from Ghana. Yeah, okay, so go ahead and let us know what you have for us today.
Okay. Yeah, I see that educating like
Yeah,
USMLE
the
part.
seems the network is very good. Um,
Please can you hear?
yes, better.
Okay, so I see um educating on
It's hard to hear you, sir.
here.
Yeah, can you speak so that I see if I can hear you?
Can you hear? Okay, so I was saying that I see the sensitization about the USMLE part all that.
Hmm.
Can you hear?
It's not very
So
good. It's not very good.
I
It's
have a question. I have a question.
hello,
Hello, I said I have a question.
hello,
Yeah.
hello. Yeah, it was hard hearing him. I would advise that if your internet is not very good, when you use the link, you want to exit YouTube so that you're not sharing the video with um you're not sharing the video with YouTube and then the stream yard website at the same time. So once you click the link, you can exit YouTube, and then so that you have the data working for only the video call. I think that would be better. Hello, Garai, Sri Joy. You are welcome to join us. Yeah, so basically today we are just interacting about the process of marching into residency in the US. Everything about the marching into residency, everything about the process from USMLE stages to um, the final match. So you can ask any questions that you have, and I'll be glad to answer you. I'm still trying to find a good position for myself so that I can relax while talking. Um, Good. I'm trying to be in the best position possible. Mhm. Good. I think this is not bad. Hi, if you're joining us, if you're joining me right now, you're welcome to use the link to join. And also you can type your comments. Also, if you have any questions, you can type the comments. And please give the video a like as well. That will help more people to come on, and it will make my video also suggested to you the next time I'm online. Um, so if you don't mind, would you let me know where you are watching from? I'll be glad to know. I want to see how far these videos are going through YouTube. Um, Hi, you are welcome to join me today. And if today's your first time, my name is Jerry. I'm the owner of this channel. I started this channel somewhere in 2021. After I took my step one, and I realized that I struggled a lot when I was taking step one, and I know a lot of people also struggle. Same, so I decided to use this channel to give some guidance to people. So basically, that is what I have been doing, and I'm using this channel as a guide to people. So if you have any questions regarding the USMLE, I'm glad to answer them. Um, any questions regarding the USMLE, I'm glad to answer them. So, um, if you may let me know where you're watching from. Um, okay, Victoria. Um, cool. All right. So we have Victoria's question here. She wants to know what kind of questions, what examples of questions do program directors and faculties ask during interview. Um, so there is a wide array of questions that they can ask. Um, so they can ask questions. Let me see. They can ask a lot of questions, and if you don't mind, give me a minute. I can go back into the videos on my phone and see if it doesn't end the video. So let's give this a try and see. Okay, I'll be right 1 minute. Just hoping it doesn't end the video. All right, so I am back. So yes, all right, so I am back. So you wanted to find out like what kind of questions do they ask? So yes, I meant what questions can we ask the faculty when they give us a chance to? Oh, that's what you mean, not what they would ask. Okay, so questions that you can ask the faculty is so there are questions that you can ask to like the residents when you interact with them about like social life and all that, and the culture of the program and all that. One of the things that you can ask the program um, directors and then the faculty is about like let me say like their performance on the board. So there's a board exam that we write after residency in order to be certified by the various boards. So you want to ask them about like how do their residents perform on those boards, and also like what do they do to assist the residents to pass the boards, for example. Another question you can ask is like asking them about what is the distribution of their residents after graduation? Do they do most of them stay locally to work in that state, or they are distributed into like all over the US? Or and also like do they give them do some of them get a chance to practice in that same hospital? Because most programs would want residents who train in their hospital to practice there because they know the culture very well. So, and also they know familiar faces, right? So you want to ask about that. That might give them an indication that you likely want to practice in that hospital or even work in that the state. Um, so that's another question that you can ask them. Then you can ask them about um, let me see what I can think about. So basically, like I do have a video on this. If you check my channel, made a video at the time that I did my interview. So I made a video about questions that you can ask, um, questions that you can ask the program director, and also questions that you can ask the chief residents. So if you check my channel, I'm going to pull this video, and then I would put the link in the video for you to see. Um, yeah, I'll put a link in the video for you to see so that you will have some idea of questions that you can ask the um, yeah, right here. So I have residency interview questions to ask the program director and faculty. So I made a video on this. It's a 7 minute video. Um, yeah, so if you check my channel, there are a lot of good videos over there, and I'm going to put it right in the comments so that you can have access to it. There we go. Hello everybody. If you are just joining me, as usual, I'm just here to interact with everybody. So that's good. So Victoria, I'm putting it right here. So this is the link to that video. Yeah, I've put it right here. So this is the link to that video. This is the link to the video that I've put under there. So questions that you can ask the program director and also the faculty during your interview. You would have some. I have some interesting questions I've put there. Um, yeah. Um, yeah. So if you're just joining us, it's the usual interaction. My name is Jerry. I'm a PGY2 resident in internal medicine here in Maryland, USA, and I'm using this channel to um, interact with people and share ideas, also receive ideas from people as well. Um, and if you want to come live to speak, I'll be glad. That'll be very easy, and everybody will hear you firsthand rather than just typing. You can use the link above. I'll share it again. You can use that link um, to join me. You're welcome. And this is a second question. I'm going to put the link down there that you can use to join the chat room, and it will be very good if you can join. To let you tell me, you can speak directly to me, and everybody will hear you directly, which is really fun. We've done this in other videos, so use this link to join the chat room. I'll let you in so that you can speak. So let's go to next question from Verma. Um, a journey right from Africa to a residency in the USA might have been tough, isn't it? By the way, love from India, sir. Thank you. Yes. It is not like an it's not an easy journey. It's not a moonwalk like um it's but I think determination and then taking it a day at a time is what really made it possible. It was hard at the beginning, then it gets harder, then it gets easier some days. There are some days that it's very hard, but you just can't stop because the more you deep you go deep into it, you realize that you are much involved in it, so you don't want to get out of it. Yeah, and I don't think that it is easy for anybody, even for people who schooled from the USA, who did their med school in the USA. They might have some things easy, like say the system is their system, right? The certain things they don't have to learn because it's already their system, like social issues, interacting with patients, um, systems in the hospital. They some of them it just comes to them naturally because they've been here, they've had sick people in their families, they've gone to the hospital several times. Some of them, their parents are working in the hospitals already. Most of the students that you see, their parents are either nurses, doctors, their siblings, their uncles. So it's like it's easier. It's much easier for them to figure things out. And even language is another thing, because something that somebody might say, it's we have to learn certain things again. Go we the English is my not it's not my first language. No, yeah, it's not my first language. I've just studied English, and I'm still learning English as we speak. So yeah, there are some difficulties and there are some challenges, but yes, yes, it's I'm here now. So I'm here now. It doesn't feel it's like right now. It doesn't. I don't feel the difficulties that I went through. Yeah. So I'll just say it's doable. And I'll be glad if you can share the link also on your WhatsApp status. If you can share it on your Facebook groups, your Instagram page, and it'll be really good so that a lot more people can join us. I'll be really glad. If you can also give this video thumbs up, it will be good. Um, if you can give the video a thumbs up, it will be really good. Um, Let me see. Calvin, proud of you, man. Thank you, Calvin. So Calvin happens to be my colleague in med school, Dr. Ahulu. Yeah, my colleague in high school. Sorry, did I say in med school? My colleague in med school. We sat in the same classroom, and he even came from Ghana to visit here in Maryland. So we hang out. It was fun. Hey, Calvin, I can't say so much. Hope you are doing well. Yeah, so if you can give the video a thumbs up. I see 7 people watching, and have only 4 likes. So if you can give me more thumbs up, I'll be really happy. More thumbs up, please. Um, yeah, I'm glad to know that, Kelvin. Good, 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 good. Good. So Kelvin is very, very good friend of mine, and yeah. Thank you, Kelvin. Um, Yeah, so if you want to join the chat, you can use the link that I put over there, the link with StreamYard attached to it. So the StreamYard.com link, you can use that to join the chat room live so that you can speak directly. If you have any questions, if you have any suggestions, if you have anything that can help somebody, you want to share it here. This is where you want to share it. If you have anything that can help somebody, even just a word, if it's a word of encouragement, like you can just share it over here. Things that you would have done differently, things you've learned from your journey. If you want to share, this is where you want to share it. So go ahead, use the link um, to join. Yeah, use the link to join, and then you can speak directly to us. We'll be glad to hear from everybody. We'll be glad to hear from every single person. Um, yeah. So if this is your first day, my name is Jerry, and PGY2 resident. Um, just using this channel to interact with anybody who has any questions about the USMLE. I use the channel to help. Basically, is to help and to document my journey so that sometimes like people will come to you and like they'll ask me about how I did this and that, and if I have it in a video, then it's easier because I don't have current information on some of the things. Like I forget, it's a long process, right? Started in 2019, so it's a very long process. um um Good. So I have a question here. How much do you pay to each hospital you wish to match to, or is it free? So during the match, for when you apply for the match through the ERAS application, during the time I was applying, they will give us the first 10 programs for free. But then the next any program after that was about I think at that time it was like I think $30. Yeah, $30. So let me see. I paid like let me just pull this out. Calculator. Yeah, so at the time I paid 23 yeah, about 2000 $300, and then I applied for 100 and yeah, I paid basically about $3,000, and I applied for 123 programs. So yeah, so I applied for 123 programs. So if I say $3,000, around $3,000 divided by 123 programs, so that'll be 113 program because the first 10 were free, right? So 113 programs. So it was around $26 for a program. So application at that time was $23 for a program. Yeah, and today I heard it's about $30. It's $30 now to apply for one program. And so um, if you are applying for about 100 programs, then basically you're looking at about $3,000 thereabout. Yeah, it's good to apply like to a lot of programs so that you'll have higher chance of matching. I know somebody who applied for only two programs and then matched into my program. So he applied to only two programs and then he matched into one of them. So it's possible to apply to. Um, no, I think I'm saying the wrong thing. He he got interviewed in only two programs. I don't know how many programs he matched he applied for, but I know he got interview in only two programs, and then he matched into my program. So yes, I don't think anybody will apply for two programs because the first 10 are free, so everybody's going to make use of that. Yeah. Victoria's asked another question. Hello, if you are just joining us, you can use the link to you can use the link with a StreamYard to join live. Um, Let me go to the next question from Victoria. So, what tips do you have for an overall good application that can attract interview? I mean, if you have an overall good application, that is a great thing. That's a very great thing. I don't know what you call an overall good application, but it will depend on the programs to decide that. But anyways, um, I think what you have to do is like submit the application, wait for your interviews. So once you get the interviews, remember that as soon as you get an interview in a program, your score doesn't matter anymore. So let's say you got a very high score, like 260s, 250s, 270, you got 240s, and then you applied, and then you got an interview. Once you get an interview, all of you that got an interview, irrespective of your scores, are on the same pedestal. So you want to forget about your scores and make sure that you are telling the programs about why they should pick you over everybody else because they want all the people that they gave interview to. All the people who got the interviews are going to they are all prospective candidates. They are all going to be ranked, right? So any of the people that they rank can match into the program. The program also, after ranking people and after selecting people for interview, they have no control over who comes to the program because if I get ranked in my program, I get ranked somewhere too. Let's say I got 15 interviews, like I got 15 interviews, and I get ranked in all those 15 programs. So I could have gone to any of them. If one person dropped out or one person matched differently, I could have ended up not matching in where I am right now. So you want to bear in mind that your application could be good, but once you get the interviews, application doesn't really matter anymore. You want to look for additional things that you couldn't put in the application that you can tell the programs so that they learn something new, something interesting from you. Okay. And you want to also talk about like how you intend to survive in residency, like say social life, because residency is really draining. Okay, if you are coming with family, praise the Lord. Residency programs love to hear that. Oh, I'm coming with my husband, and my husband will be working, or I'm coming with my mom, or I'm living with my mom, or I live around here where I know a lot of people. Residency programs love to hear that because they know that you have that social support and you wouldn't be burned out when you go home after work. Y- Um, yes. All right. Do we have more questions? Yes. Let me see. And again, if you want to join live, it will be easier for interaction purpose. You can use the link with StreamYard. Just click on the link. You don't have to necessarily show your face, but if you want to show your face, praise the Lord. So you can use the link with StreamYard. Click on it, and I'll let you into the chat as a guest, and you can speak live on the video. Okay. Um, Next question. How do you make a good application? That's my question. Victoria, your question. Okay, so you said, how do you make a good application? Okay, so your question is how to put together a good application. This is, I don't think it's a straightforward question. Things that they are looking for, that's what you want to put in the application. You want to let them hear what they want to hear, right? So one, you want to talk about your clinical experience, and there's some things that I've heard that you shouldn't put in your application, like if you're talking about observership, you don't want to mention the word observership in in your application. It's more, maybe you should rather use the word clinical experience, and that'll be more helpful if you use the word clinical experience. Um, and you also want to be able to, um, if there's any gap in your training, maybe after school, you want to be able to talk about that gap very well. Um, a good application for me would, for me, I always see a good application as from the eyes of the person receiving the application. um you, the applicant, might think you've put in a good application, but it's from the person who is looking at the application. So a good application would be one that uh, ticks all the boxes. So say, um like, you need to get good letters of recommendation, right? um you don't want to apply without letters of recommendation. Some people apply and then they have only two letters of recommendation. You want to get at least three, because most programs want at least three letters of recommendation. They want at least 6 months of US clinical experience if you do have. But if you don't have, also, you can still apply. People match without US clinical experience. Um, and A good application will also be one that satisfies the requirements of the program you are applying to, so that if a program says, my cutoff is 240 or 250, or the cutoff for the year of graduation is maybe 2 years or 3 years, you want to make sure that you abide by those rules, because they wouldn't look at your application if they want 2 years of graduation and you have like 5 years of graduation. You don't want to even apply to those programs, right? So things like that. You want to make sure that if you're applying to a lot of programs, like say you're applying to surgery, you're applying to internal medicine, you don't want to use the same letters of recommendation, because it's gonna look different. You want a surgeon to write a letter of recommendation for surgery residency, uh, and also if you have an internist writing your letter of recommendation for internal medicine, great, right? So I think like that. But once you start the application on the ERAS website, just tick every box. Make sure you fill in every box. Research publications. You want to make sure you have some, at least you want to have six, for if you are applying going to apply for fellowship. You want to have at least six publications, be it case reports, be it research, be it manuscripts. You want to be able to have those and be able to talk about them. Yeah, and yeah, basically that's what I would say. Yeah, about a good application. A good application comes, the scores doesn't really matter because the scores are program specific. Some program want 240, some program want 250, some program want 260, some programs want 235, some programs even want 210, right? So the 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 scores doesn't matter, but before you submit your application, don't submit it blindly. There is a website called Match a Resident. So I used that website, and I put in all my scores and years of graduation and everything. Then this website is going to tell you programs. It will give you a list of programs that you qualify for, or programs that you should look at, programs that people who have the same credentials like you have matched into. Right. So you really want to be aware of what you are doing. You don't want to just throw in your application. Okay. Yeah. Be really sure that you tick all the boxes of all the programs that you are submitting your application to. If you don't tick any of the boxes, I would advise you don't waste your money. Do not waste your money because you wouldn't get an interview from there. Because some of the programs they use a computer system to filter people out unless there's someone in the program who is going to specifically speak for you, so they go pull your application, but otherwise it's gonna be filtered out. Last year, about 4,800 people applied to my program, and we have 15 spots for categorical, and we have, yeah, I think we have about 4 or 5 spots for the prelims, right? So out of 5,000 people, we have about 20 people marching into residency in my program. So you really want to make sure that you tick the boxes that the programs are looking for. Go to their website and then look for what they are looking for and submit that to them. If you cannot go to each program's website, like 100 programs, I don't think going to the website of 100 programs is someone can do it, but it doesn't really make sense. I only went to programs websites when I got interviews from them. Then I'll go to the website and read about them. But otherwise, what I did was that I used Matcha Residence. I put my score, I put my med school, I put my years of graduation into Matcha Residence. Then it told me like a list of programs that people from my like a med school that looks like mine, people from years of graduation that is like mine, people who have score that looks like my score match into these programs. Or it will tell you some people got interviews in this program, even though they did not match, they got interviews. And what you want is interviews, right? So you also want to make sure that your chances of matching into any program that you apply to are high before you submit your application to them. I hope that helps. um, if you are just joining us, my name is Jerry, internal medicine resident at PGY2 in Maryland, Greater Baltimore Hospital. I'm doing my cardiology fellowship. Sorry, not fellowship. I'm doing my cardiology rotation in the Johns Hopkins Hospital, and I have today off, so I decided to come back and interact with people on my YouTube channel. Um, and if you have any questions from steps to residency to interviews, you want to ask here, and I also have a link up there. The link has is the StreamYard. You can use that and join the conversation as a guest on this channel, and you can speak live to us, and we would hear your voice. Um, let's go to the next question. Who is this? Good job, bro. Thank you. Thank you, Bernard. Um, let's see. To rephrase my question, it looks like I'm not getting a question right. So you got 15 interviews. So I want to know what made your application good enough to attract 15 interviews. Honestly, I don't know what made my application good. I got I submitted my application, whatever I had whatever like I had whatever the program wanted, right? Like one I had the score that they wanted, right? And because my program I think they wanted like 235, and then I got a 250, right? So I had the score they wanted. They wanted, I think, about 5 years of graduation, and I had four, right? And they wanted clinical experience, I gave them. They wanted publications, I gave them, right? And otherwise, I don't know what else they wanted. So I just waited for their interview, and I did the interview. And doing the interview was also good because that I was able to flow with them during the interviews, and so it's not anything so special. The requirement is to do your step one and step two. I think that's the most important thing. Do your step one, your step two, and tell them about yourself. Period. I think that is it. It's nothing so special that you want to really do. Yeah, I don't think it's a very big deal like as we take it, because once you match, you realize that, oh, like, so this is it. It's not like a very big thing that I thought I couldn't overcome. Um, but yeah, but nonetheless, still take it serious. Take it very serious. But you will overcome this as well. Yeah. Um. All right. Yeah. So you can use the link to also join us, and you can use the link to join us, and then speak to us live, if you want to, and I'll let you into the comment. I'll let you into the chat room, and then you can um um so if you have any further questions, I'll be glad to answer that. um I do have okay, I do have more questions down here. um okay, I do have from Darlene Jones. So can you give tips on how to publish case reports or research? Do you have to be the main author for how many articles? So basically, yeah, you can. So when I was submitting my application, I only made one publication that I was the first author. Um, yeah, I was the first author for that case report, and then there were others that I did with my friends. They were the first author. So all you want is that you want to have something to show, and then you want to give your contribution, and also because when you are doing the application, they will ask you for the role that you played in that publication, and then you can state it. Most important thing is to know what the publication was about, and you can feel comfortable to talk about it. I think that is the most important thing. Yeah, and about how to publish a case report. So there are several journals that you can consider after writing the case report. So say this how to come up with a case report. Say you go to the hospital one day, and then or your friend is working or you are working, and you find a case. You want to be able to decide if that case is interesting, what makes it interesting. Say like what is unique about that case that you found, what is the presentation. Is it a new, let's say patient took a new drug that just was released and nothing has been published about one of the side effect that the patient is experiencing, and so it's a new side effect that you have just seen. There was like a case report that I can talk about where there was a patient whose daughter, um, the patient's daughter, came home one day and then gave the mom. So there's this Listerine mouthwash, right? They have one that is like I think it's tiny little sticks that you it's like it's a gas. I think it's a gas form or something. So you put it in your mouth just to inhale it, and it gives you a fresh breath. So this lady gave it to her mom, and as soon as the mom put it in her on her tongue, and mind you, FDA have just approved of this in about few years, right? So as soon as the woman put the thing in on her tongue, she had a sudden chest pain, chest tightness, and she had to call the ambulance. They took her to the hospital, and they did an echo, and this woman had Takotsubo cardiomyopathy. So there was no stressor like associated usually with Takotsubo, like emotional stress and all that. She had nothing like that. She was in her normal state of health. And so this we would say that people should watch out for this, because this is Takotsubo cardiomyopathy. She presented with typical presentation of Takotsubo. Echo showed that, and the EKG findings were similar, and this lady was treated conservatively, and within days she regained the function of her left ventricle. So this is an interesting case, right? Like nobody has written a case of Listerine induced Takotsubo cardiomyopathy. So you want a case that is interesting. Like why should people read your story? Like what is unique about the story that you are writing? Is it an atypical presentation of a common condition, but it's presenting atypically? So it should be an interesting thing, and so you just write about it. Writing is usually not so hard. So you start by introducing the case, then you talk about how the patient presented, how you manage it, then you give recommendation, right? Like going forward, you recommend that this, like if this is how you guys manage it, or if there is an atypical or an unusual management of something that maybe you tried and it worked, right, out of the guidelines. You tried another form of management and it worked. So you can tell people, hey, if someone present this way and you tried this and that and it's not working, that this is something that we tried for our patient and it works. So you can look into that. So, and then now, after writing your case report out, you can give it to people to proofread. And of course, you might not be the only person writing it. So, you have all your colleagues read through it. And then next is publishing it. You need to find credible journals. Some are free. Some of them you have to pay before you publish. And one that is gaining grounds these days is called Curious. Is CURIOUS. Reus. Curious is gaining grounds. It's free to publish in it. Um, and if you go to Curious, you'll find that they have some conferences that usually people present from. So you can also register for those conferences. Some of them you can join them virtually, and some of them also you can travel if you have money to travel. That is also an opportunity to get a visa, because once you write to the conference organizers that, hey, I have a case that I want to present and I want to present it in person. And when I went to my conference in Texas, San Antonio, that was in 2022, I guess. So there were a lot of people, a lot of students who came from India for that conference, and so they used that conference as a means to get the visa to come to the US. Then once they finished the conference, they stayed to do their US clinical experience, and after that, they went back, and then they matched, and then they came back with the H-1B visa, and they are doing their residency. So yeah, it's not so difficult. You just have to start writing something, start looking for cases that are interesting, and write about it. I hope I answered your question. Now let's go to the next question. This Victoria, thank you so much for the detailed answers. Very helpful. You are welcome. Next person is Michael. Yeah. So thank you all for joining me today. My name is Jerry, PGY2 resident in internal medicine here in Maryland, Greater Baltimore Medical Center. That's where I'm doing my residency, doing my cardiology rotation in Johns Hopkins Hospital, and I'll do my neurology rotation also in the Johns Hopkins um, Hospital. Um, and so I'm the owner of this channel. I use it to educate people. A lot of you might have known me already. If you are just joining and you haven't subscribed, please subscribe so that anytime I am making a new video, you can be alerted. Also, if if you can share this video to other people to get more people on board to ask their questions. Next thing is, if you want to speak live on this channel, you can use the link. I have put the link. If you scroll up, you'll see the link. It says streamyard.com. Streamyard.com. You can use the link, and I'll let you in as a guest, and then you can speak live, either through video or through audio, and then that will be helpful. You can give your contributions. You can say whatever you want to say. So let's see. Yeah, that was an interesting case. So this Listerine induced cardiomyopathy, very interesting. Um, yeah, 3 observerships, 3 LORs. That is enough. That is exactly enough. 3 observerships, 3 LORs. Just make sure that the observerships. So yeah, again, one thing I said is you don't want to use the word observership. It's clinical experience. Do not use the word observership, because observership, basically look at observership as putting your hands behind your back, following the doctor, and observing with your eyes. That is observership. You want to use the word clinical experience in your application. Forbid the word observership in your application. Never mention that word observership. It should be clinical experience. But yes, so 3 clinical experiences, 3 LORs is enough, should be enough. Um, yeah, you are welcome. You're welcome. Thank you too for joining. Um, there we go. And I hope I've answered most of your questions. If you have any further questions, I'm available to answer. If you have contributions, if you've done things on your journey that has been helpful to you, feel free to share with people right here. Okay, feel free to share, to tell people what you have done that worked for you on your journey. There are a lot of people who are yet to start. Some people are yet to even decide to start. People are still thinking, should I begin this? Some people are thinking that it's a very long journey. It's gonna take me many years to finish. Yes, it might take many years, but if you don't start, it will still take you many years. So you want to start now if you ever think that you would start. You don't want to say next year, then every year is gonna be next year. I remember some people 5 years ago would say I will do it next year, and then they keep pushing, and it's 5 years already, and soon it's gonna be 10 years. So if you want to start now. Um, Somebody also said brighten the corner where you are, so it's also possible to brighten the corner where you are. So that's completely up to the individual's journey. Um, okay, so I do have one question, Ali. Is 5 years of graduation a red flag? I wouldn't call it a red flag. It depends on the program that you are applying to. It will be a red flag for some programs, but some programs also no. Even some programs, 10 years of graduation is not a problem, but some programs, even 4 years is a problem. So you want to find the program that would accept your years of graduation. That's why earlier on I was saying that before you apply to the program, you want to visit their website and find out how many years of graduation would they want. Now, if you are going to be doing that for there are a lot of programs, maybe over 1,000 programs, but if you are going to be doing that for all 1,000 programs, then that's going to be very tasking, right? So that would be very difficult to do. So what I did was, there was a website called Match a Resident. So um I'll put the website here. I'll look for it and put it in the comment. So Match a Resident, it is the website that I put all my credentials into. Um, so let me look for it. I'll put it in the link. So you put all your credentials into this Match a Resident, and then it tells you programs that you possibly qualify for, programs that people from, let's say if you are from India, you're from Ghana, it will tell you people from Ghana who came from this university with this kind of score that looks like yours, and also this years of graduation that looks like yours, they matched into this program maybe 2 years ago, a year ago, and or they got interview in this program a year ago or 2 years ago. So once you do that, you'll realize that you don't have to work so hard going into the website of about 500 programs in order to find out basic information. That will take you like almost two months to come to do. um so this is called Match a Resident. I'm going to put a link right here so that you all can see it. Match a Resident. There we go. um yeah, this was very helpful to me. Very helpful. It's one of the best website that I that helped me too much. One of the best. So I'm putting it right here, and all of you can see it. Match a resident. You can save this. It's one of the most important website that you would find when you are applying to residency. Um, um, okay, so let's see if there are other questions I can talk about. All right. So regarding letter of interest, as by Michael, when should we send them out, and what should the content be? Honestly, I was talking about this 3 days ago. So letters of interest, seriously, they are not important to me, and they are not important because programs don't have time. Like, I've been in residency and I've seen how busy we are during residency. I've seen how busy the program coordinators are. Usually these letters of interest goes to the program coordinator, not the program director. If it goes to program director, maybe she will read it, maybe she will not. She can read it and reply you, but after responding to you, that is it. They forget, because a lot more people are going to send these letters, right? And there is no reason to give preference to one over the other. Everybody will have to go through the application. And the fact that you send a letter of interest to a program does not mean that you are going to match into that program, because at the end it comes, the matching is about the error system. The Yeah, because they have the computer system that distributes residents, so the fact that you send a letter of interest to a program does not mean that they are going to consider you. I would say that you should channel that interest into that letter, the energy, channel that into perfecting your application, and maybe taking step three. Okay, if you haven't taken it already, you should rather do that. But program coordinators are the most busy people. Like, they are still following what we are doing in residency. They are prepping to receive people. Like, basically, people like the PGY ones now, they started about 2 3 months ago, and we are about to they're about to start receiving applications again. So there is no time to read somebody's letters of interest when they will actually rather use that time to be reviewing applications. So I would say, don't, like, waste time. If you do it, fine. Some of the programs are misleading. They would tell you, oh, we love you, we do this, we want you in our program and all that. You are going to rank them, and you realize that you will not even match over there, because probably they didn't rank you high, or somebody else, they rank somebody else high and all that. So it's not really important. But if you really want to send a letter of interest, then you want to send it as early as possible. Around this time, nobody has time. They don't have time. Best thing would rather be looking for somebody in that program who can recommend you to the program. That is better than sending a letter of interest. Look for people who can speak for you, people who are already in that program, who have relationship with the program director, program coordinator, the assistant program director, and they can speak for you, rather than you sending a letter and then they don't know you, right? You're just anybody who's expressing interest, and they don't know you personally. Programs want people they know. um what do I mean by people they know? They want people that somebody in the program knows them, and that they will always go for those people. Say your brother is in the program, somebody from your school is in the program, or somebody who ever worked with you is in the program, who recommended you. that person is going to help you when you come into the program. They would assist you. You will be able to have you will take them as your go-to person, that if you have any challenges you can go to. Outside the hospital, they are going to support you, right? Social life and everything, recreation, they'll support you. So programs want that, they want good mental health for their residents. So they, if you have familiar people in the program who can speak for you, look for those people rather than sending out letters of interest. But yeah, that is my thoughts. um Now let's go down. Does medical school scores and GPAs? Not really. Not really. It makes your application probably look good, right? But it doesn't really matter. People always choose step scores versus the medical school scores. So because they believe that the step scores are more objective than the medical school scores. They were not in your med school with you. It would look good, right? And if you have a track record of being good at med school, then you got a very high score on the USMLE, and then you come into residency and also have a very high score. Then that's like a consistency, and it's good. But I would say it's not anything to go by. It's nothing to go by, so it's not important to me. Yeah, I don't think any medical student is bad, so it's not really important, and that would not influence your match also. Do all PGY ones get same salary across all specialties? Um, or is it tailored and specific to particular specialties? Yeah, so basically it's around the same thing. It's around the same figure. Is So internal medicine will not be different from family medicine, will not be different from surgery. What makes the difference is the cost of living in that state. That makes the difference in the paycheck that we get. But averagely, we are all getting the same thing. If I'm training in Maryland and I'm doing surgery, and another person is doing internal medicine, it's gonna be the same. It's basically gonna be the same. If it's not same, then the variation might be maybe $1,000 per year, which is less than $100 in a month. So it's not really anything different. Yeah, and yeah. So again, to add to that, if I'm doing internal medicine here in Maryland and somebody's in Florida, it's likely to differ. Um, and also, if you are more in a rural area and the program is fairly new, then it's likely that the paycheck will be higher because um, they want to use a lot of incentives to attract more people to their program. And the paycheck doesn't really change. Like in my program, like my attending was telling me he trained in that program over 20 years ago. And the paycheck that we are getting now is almost the same as what they also got at the time over 20 years ago. So it doesn't really change. It doesn't really change. I hope that answered your question. Yeah. Sometimes if you are lucky, they just add maybe $1,000, maybe the following year raise, just $1,000 raise like we got recently. Um, um, so yes, I put this link. That is a matcha resident link. Um, all right, let's go. Let's see. Uh so be regular. All right. Please be regular on YouTube because we miss you. Thank you. I miss you all too. Yeah, I miss you all too. It's just residency got me busy these days. I got very busy. And I also had to like focus on improving myself, studying. As I said, we take in training exams every year to test your readiness for the boards, and also to test how much knowledge you have acquired since you came into a residency. So all that is It's part of the reason why I just took time off YouTube in order to focus and also reflect on my practice over the past year. Um, but yes, I'll try to make time to be coming, if even if it's like once a month. Sorry, yeah, once a month or once a week. I'll try to be coming more frequently. Um, yeah. Um, yes, I do have somebody who matched from South Africa, and they're in my she's in my program. One lady, a match from South Africa. I cannot mention her name, but if you everybody's photo is on the website in my program. So if you really want to see it, you can go there. It's GBMC Hospital. You go to our current residents, and then you will see the photos of everybody over there, and they'll write their schools that they graduated from over there. So yeah, there's somebody from South Africa who matched into my program, and she's practicing in my program. So yeah. So basically, it looks like all countries are accepted. In the US, they have specific requirements for the university. So um, except countries that US regards them as non-friendly, like currently, like people from Russia and I don't know. Um, yeah, I don't know if Ukraine is also part, um, but yeah, um, yeah. So yeah, let me not think about that. Okay, cool. So basically, yes, Mozambique. I believe. But if you don't, if your country does not speak English, then you will have to come and learn English. There is somebody in my program who he told me he came to the US and he's from Togo. He did not speak English, so he finished med school. He was working in his home country, came to the US and then learned English. Then after learning English, then he started taking the USMLE, and then now he's in residency here. So um, everything is doable. Everything is doable. Um, all right. So if you are just joining, it's just a usual drill. My name is Jerry, PGY2 resident. Just interacting, sharing my experience and thoughts. If you want to join the chat, you can use the link that I've provided up there. Is called the StreamYard.com. StreamYard.com. I can post the link again. Just click on the link, and then you'll be able to join the conversation. Um, yeah, just click on the link, and then you'll be able to join as a guest, and I will invite you to join, and you can speak to us. I love to hear your voices. I love to hear your voices. Mm, let's see. And also, if you can give a thumbs up to the video, I'll be very glad. Just a thumbs up to the video so that we get a YouTube algorithm to pick it up. And if you can also subscribe to the channel, will be very great. Also, if you can share the link to people, people who have doubts, invite your friends, people who have doubts, they want to hear from somebody who is already practicing here. Um, I'm ready to share my journey and my suggestions to everybody. So you can use this link that I just put over here. Use the link to join me, and then you can speak live, and everybody will hear you firsthand. Um, okay, so I have one here. It's step one, step two, 240 plus, step three done, and three LORs, 5 years of graduation, old school, old grad, and how much chance of matching in IM. I think you do have a very high chance of matching into internal medicine. What I would do is put these credentials, okay, these credentials of yours go to Match a Resident, okay, and create an account, and then put your credentials in there. It's going to give you a list of programs that you potentially qualify for, and you can review those programs and apply to any of them. You have a very high chance of matching. Yeah, I think so. Yeah, I believe you have a very high chance of matching into internal medicine. And every year we get over 75%, yeah, percent of people who match, over 70 to 80% of people who match. So you have a very high chance of matching. Yeah. So your clinical gaps, you want to be able to explain those in your application. And during your interviews, if they ask you, you want to be able to explain it to them. Um, yeah, so I have the link over there. This is the link I put there, streamyard.com. You want to use the link, just click on the link and then you can join as a guest. Um, yeah, you can join as a guest and speak to us. It looks like today nobody wants to join me to speak. Last time I had a lot of people join. Um, I had a lot of people join the last time. So feel free to join. Just talk to us, share your experience. Um, Ali, if you can tell us how you got your high scores on your step. Yeah, on your step two, how you managed to get your high scores. If you can tell us, join with the link and speak to us. Share your experience. How hard was it? Was it hard? Was it easy? Um, it would be nice if you can share your experience with us. I think it's going to be more stable now. Yeah. Do I have another question? There we go. So to match, do you have to have an LOR from US attendees? Um, they so LORs from the US attendants, it's they hold a stronger power, right? Yeah, they look stronger when you have that. But I know people who have matched and they've never stepped a foot in the US. So that's definitely something that you can also think about. You don't have to come to the US. If you have great doctors from your country that can write a very good letter of recommendation for you, and that should be good enough. That should be good enough. Um, and the other part of your question is, and what can you do as a non-US IMG to increase your chance of matching into anesthesia? Honestly, disclaimer: I do not have a lot of experience in people who match into anesthesia, but it's just gonna be like surgery. If you are going to apply for surgery and you're going to apply for anesthesia, for sure you want to have come to the US to practice with anesthetists and then also or anesthesiologists, right? And also surgeons. And if they hold your hands and then give great recommendation to you, you are likely to match. Also, if you are in another country, you want to work with great doctors from that field, and then they'll write a good letters for you. I think basically it's all about having publications in that field and also having a good letters of recommendation. Um, yeah, because surgery, it's all about publications, a lot of publications in surgery. I know that helps them a lot to match. Yeah. Um, I need to grab my computer 1 minute. Let me see. I'll be right back. It's back. All right. So we've done almost 1 hour and 30 minutes. If you do have further questions, to feel free to let us know. And So where can I search for the hospital you mentioned earlier? The hosp- So just Google Greater Baltimore Medical Center or GBMC Hospital. Google GBMC Hospital. GBMC Hospital. Google that and you should be able to find it. In this hospital, we do not do anesthesia in this hospital. We do we do internal medicine, we do OBGYN, we do colorectal surgery, and we do otolaryngology, otolaryngology. And I think these are the residency programs that we have in my program. Yeah. Um, yeah. Colorectal surgery is a fellowship program. Yeah, I think it's a fellowship program or so. Yeah. But yeah. Um. Yeah. So I have a next question here. Um. So how is the residency as someone who just graduated med school? So residency programs usually are looking for people who just graduated from med school because these people are teachable, because this is the first time they are hearing a lot of things. So that is what they know, and they'll be able to learn the current best practices, and versus someone who is already strong-headed and has learned things in a certain way, and you are going to tell them to do away with that and do something else. So residency programs usually want people who just graduated from med school. Um, it's a lot of learning to do. If you just graduated from med school, it's a lot of learning. Even if you've been practicing, but in a different country, it's still a lot of learning to do. There's no big difference between somebody who has graduated a long time ago versus someone who just finished med school. um, the kind of practice we do here is more evidence based, is guideline directed. So I know most countries it's not like that. If you are practicing something and it's not based on guidelines, then we don't do it. We'll have to find information as to how this was done, the what evidence, what level of recommendation, what is the strength of the evidence that they saw in maybe that clinical trial before accepting the recommendation. And then we will have to go to the various associations and look at what they recommend for us to do for patients. So that is how we practice. We don't practice based on experience. We base our practice on current guidelines, and guidelines change every year. So this year they will say, hey, maybe if you guys have recently heard about um, this SGLT2, right? SGLT2 medications, and also you've heard about the GLP-1s for management of diabetes and people who are at risk of cardiomyopathies or cardiovascular diseases and all that. Like every year, recommendations change. Like currently, people who have diabetes and also at risk of heart disease or also who have like heart disease itself, they'll say like start them when you start them um, on beta blockers and ACE inhibitors. The next thing is you have to do the SGLT2 inhibitors and all that. So every year it changes. This year it has really changed. Like that's like a second level of recommendation for the SGLT2. It's strongly recommended, irrespective of their their like irrespective of their function as let's say helping the person to pee and lose the volume, right, so they don't have congestive heart failure. It also has its own mechanism that is not well understood, like cardioprotective mechanism. So that recommendation was not there like 3 years ago or even 2 years ago. So it's something like things change every year. So if even if somebody was practicing in the US like 3 years ago and did not read the recommendation like last year, then their practice is gonna be not evidence based. It's gonna be redundant. So it's like you must always keep up to date with information. Um, let's see. Someone's asking, how is family medicine in the USA? Um, yeah. Again, before I answer this, my name is Jerry and PGY resident. Um, So I have the link that you can use to join the chat room, and then you can also talk to us. You can share your ideas. You can ask your questions. So I'll let you in as a guest if you click on the link that has streamyard.com. You can scroll up and you will see it. It has streamyard.com. You can use that to join as a guest, and I'll be glad to let you in to talk to us. How is family medicine in the US? So family medicine, they are trained to take care of the whole family. So people of any age, from infants, probably not infants, but from children. Children, I don't know the cutoff, maybe from 3, 4 years. From children to any age. So family medicine are trained to do that. They also practice as internal medicine doctors. Some family medicine doctors can work as hospitalists, just like internal medicine doctors can do. Most family medicine doctors have their own private practices. Family medicine doctors also work inside the hospital where they have their own practice in the hospital, or they are part of a group in the hospital. And the difference is that internal medicine doctors do not take care of kids. We only take care of adults from 18. So that is basically the difference. Um, yeah, there might be more, but those who are training family medicine will know better. Um, are you able to ask this question again? USMLE Hunter, if you can ask this question again, I'll be very glad. I'll go to the next question. How is life expenses out there, your city? How much you guys get paid after tax deduction? Um, yeah, after tax deduction, so basically, like residency pay is just it's just basically for expenses, like because you don't get to save anything. It's more like hand to mouth, right? Um, so like we get paid like every 2 weeks, and the first week pay is basically for rent. My rent takes everything. for the first week pay. Then the second week pay, my car insurance, electric bills, other things that I'm paying for, that like yeah, other things I'm paying for, like, and I need to pay, like internet, mobile bills, and things that I bought on credit. Like I need to pay all those things. So by the second half of the month, that takes care of that. Maybe by the time I get my next pay, I'll have maybe $100 or $200 left in my account. So it's kind of, residency pay is nothing to write home about, but um, if you live like a modest life, if you live a modest life, you should be fine. And I know, like, there are some people in my program who, like, say, the I am just right, who came from other countries. They've been able to use their residency pay to take very good cars like SUVs. SUVs, very very new, brand new cars, and they are using their residency pay to pay for it every month, and they still are able to pay for their rent and all that, and they still live normal, and they still, so it's manageable. It's not anything big. It's manageable. People are using that to take care of a whole family of three, four. So it's manageable. It's doable. And whatever you Google online is likely to be true. And if you go to my program website, or some of the website, the value should be there. The range is $60,000. To the highest I've seen was $79,000. That's the highest that I have seen in a program in Florida. They were offering $79,000. And if they would have increased it by now, maybe $80,000. So $60 to $80,000 is the range. Yeah, maybe 59,000 to $80,000 should be the range. It all depend on the state in which you are, and the cost of living in that state. I do have a question here. Is residency stressful? Um, um, if you say stressful, like what sense? It is demanding. It's very demanding. You don't have a lot of time for yourself. You don't determine your schedule. You can have an input. You can ask maybe some adjustments to be done, but you basically are working mostly 6 days in a week, mostly 12-hour shifts, which can extend, that is on paper is 12 hours, but you would have to, I like to go to work early. I'll go to work like an hour and a half to read about the patients before I take report. So already that puts me at 13 and a half hours. And then right when you finish, in PGY1, I wasn't so fast. So sometimes I'll finish before, I'll bring my notes home to write. I'll finish some of my notes by 2 a.m., by 12 midnight. So, and then I have to sleep and wake up again at 4:30, start reading about my patient before I go to work. So, and that is a cycle. You are doing this for a rotation that you are on for about 1 month. So in 1 month, that is what happens. But we have a good mix. We do have a good mix where we do inpatient. So inpatient, if I'm on for 4 weeks, it's gonna be very a very like difficult rotation, right? But then once I get off inpatient and I go to clinic is also like, it's not too stressful, because you are scheduled to see outpatients, and sometimes if they don't show up, then hey, we are happy. Don't tell anybody. Don't tell anybody that I said we are happy, but we are not supposed to be happy that patients did not show up, because the more patients you see, the more you learn, right? So if patient doesn't show up, then I'm like, okay, I have some 1 hour to rest. You can be, sometimes you only have two patients showing up, but there are days that you have 8, 9 patients showing up. So you have to finish their note. And now I've learned to finish my notes before I get home. So Usually I'll get home like 5:30 to 6 when I'm in clinic. And clinic is every 6 weeks. So every 6 weeks I go to clinic. So and when I do it, it's Monday to Friday. So I'll have Saturday and Sunday off. Um, so I'll call that is like a golden weekend. So in that case, like you have some 2 weeks, sorry, some 2 days to rest. Then we also have elective rotations, which also we work with the consultants. And when you're on elective rotation, also you have 2 days in the weekend to also rest. But when you are inpatient, you are working in ICU, you are working with, like right now I'm in the PCU, the cardiology PCU. Um, I just have 1 day off, in the week. So it's it's like that. So basically residency takes all your time. If that's what you mean by stressful, it takes all your time. All right. And again, just a reminder, you can always use the link that I'm going to put out there right now. I'm going to put this link. You can click on this link and then you can join the channel and then you talk to us. You can come on the show and then speak to us live. Um, you can speak to us live. Okay. All right. So next question from Ephraim. I practice as a doctor in Ghana, passed the step one, but I lost my desire to pursue medicine and got into and got and or you lost your desire to pursue medicine and go into residency. Is residency tiring or stressful? Yeah, I think I have answered your question. So of course, um, it is it is it is not just that easy. It's not that easy. You are working hours so that you can get more training. It's 1,000 days of training. um that's a 3 years. It's a 1,000 days of training. And I would say since I started, the first year was the most hard year, because that's when you are learning medical knowledge, fresh medical knowledge. Whatever we learned in the books are different from what we are practicing now. Fresh medical knowledge. You are learning the system that you are working in. You are learning your patient population. You are learning the culture. You are in the environment or the culture in the community. You are learning the culture in the residency program. Also, you are learning the culture in the hospital. You are interacting with patients that you've never interacted with before. A language. You are learning how to communicate as a doctor. You're learning how to write notes as a doctor. So first year is kind of a very is the most difficult among all. And after first year, then things begin to ease a little bit, and towards third year, things begin to ease, because now you know a lot. You know how to you like you can practice better, right? You've learned a lot, so things look more easier. You are able to, like, I remember first year, like my notes will be like very long, like very long notes. But right now, like, I just go straight to the point. I just like go straight to the point. So it's like, as you practice, you cut out like wastages and a lot of things that you don't have to carry in your progress note and all that. You can streamline them and just put the important things over there. So you learn over time and things become easier. Um, I hope I answered your question. Um, but if you've taken step one, then it would be a good thing to pursue the step two also, because for my experience, step one was the most difficult. So if you cross step one, it should take you like 4 or 5 months to take step two as well, and then you can apply for March. So you're not actually far from applying to residency. You're not actually far from that. Um, and medicine is a calling, right? So if you have a calling another thing and you think that medicine is not the way to go, fine. For me, I um, say that if somebody's coming to medicine because of the money and the prestige and all that, then um, it's it's a prestigious job, but I don't like now that I'm in it. I don't really see the prestige in it. Doctors are smart; they save lives, but they don't have like that work life balance. Their life is just in the hospital, and they basically don't even get enough time with their families. They close, come home, put their head down a little bit, and they wake up again, and then they get called at night and all that. So yeah, yeah. So you really need to have that calling or that inward desire to pursue this. Yeah, in order to be able to do it long term. Yeah. Um, Let me see the next one. I'm a GP in Mozambique. I'm interested in starting the process for postgraduate studies in the US. What is the procedure? When you say postgraduate studies, what would you be able to emphasize on the postgraduate studies? If you're talking about doing like master's program and all that. I don't have a lot of information on master's program. I know a lot of people have done that, but basically what I know is you go to the university's website and then you apply, you follow instructions there, get in touch with somebody they always have someone, a public relations person who can talk to you, and then they will guide you how to apply for it. And I know these days a lot of students get visas easily, so it will be a good thing to do. Um, um, you mean is there any school for exam preparation? Yeah, there are tutoring programs. I think Kaplan was one of them that I heard about, and then there was another one, Dr. Francis. I've forgotten the name of his, but Dr. Francis, he also had a school those days, but I did not join. I know people who joined with Kaplan and then they came back and they still had to start from the scratch because it's not worth it. I don't think it's really worth it. It's better to join a USMLE groups and find study partner and both of you study together. But it's really not worth it. Um, yeah. Yeah, so this will take me back to Ephraim, if you are still there. Are you able to throw more light on, like, if you want to share with us, like, why you are demotivated? If you want to share with us why you are demotivated, like, maybe we can motivate you to go back because you are already in the middle of the river, right? Do you swim forward to cross the river or do you want to swim backwards? It's gonna be the same effort. If you swim backwards out of the river, it's the same effort as if you swim across the river. So if you're able to share with us why you think you have lost motivation, you can also use the link and then you can speak to me. You can use the link. You can join the video and then just talk to us, or you can still type it why you feel demotivated. Um, yeah, so this is the link over here. Just go to the video and then click on the link, streamyard.com, and you can join. Can I get more likes on this video? Right now I have 14 likes. um I have 14 likes. I have 15 people watching. I know I can get more likes than that. So if you can give me more likes on this video, I'll be glad to speak to yeah, I'll be glad to get if I can get more likes, and if you can use the link also, it will be good. Um, let's see. I don't know if this this light is. I think I need more light here so the video can be more clear. Yeah, this is better. I think I needed more light. Cool. Um, all right. If you are just joining, this is the USMLE Booster channel. I'm considering to change the name soon from USMLE Booster to something else because now we are doing more than USMLE. It's not just USMLE. It's everything USMLE residency. And soon, when I start practicing as an attendant, then it's gonna be practicing medicine in the US. So it's a lot of things. I don't want to limit the channel to just USMLE. But yeah, so far I've been using this channel to guide a lot of people, and I'm so happy when I hear people say, "Hey, I have passed my step." I have passed my step, and I'm so happy to hear like a lot of success stories. A lot of people have texted me and they're like, "Hey, I've passed my step. I'm so happy. I'm going to take step two." Then some are like, "Hey, I've passed step two. I'm applying for fellowship for residency." And some people have also matched into residency that I know last year. So I'm very happy for you guys. Very very happy that everybody's making progress every day. Um, um, let's see the next question. Can you share, let me see, if you have taken your step three before applying for to the match, and if so, um, how long did it take you to prepare for step three? So I took step one and two, then I applied for match, and then when I matched, I think the match was in March, right? So after matching, I took a trip to, I think, yeah, I took it. Did I? Let me see. Yeah, after matching, I took a trip for a few days of vacation. And then when I came back, I took my step three. I think was like, but definitely I took my step three before I'm going into before starting my residency. I matched before taking my step three, and then right after taking my step three, then I started residency. So um, I think people should take step three before going into residency. And if you're asking how long it took me about maybe about 2 months to take step three, maybe about 2 months. So basically, I didn't spend a lot of time on step three because I had match already and the scores did not really matter to me anymore. So I did like 50%, 40, 50% of U World. And then I went to take it. And then I did CCS cases also, ccscases.com. If you can check that also, CCS cases for the day two part. And um, yeah, so CCS cases also, I did that also, and that was it. So I didn't really spend a lot of time. And if you are someone who just took step two, you don't want to wait too long to write step three because you would forget things. And there are a lot of information from step one on the step three, and a lot of step two information also. So you don't want to really spend a lot of time like in between them. Just take it. Don't stay too long to take it. And if you are going into residency too, because first year is kind of a lot of things. First year is very busy, so you want to take step three. In my program, if you don't take the step 3 before the end of, or by the end of first year, you cannot go to second year. So if you are going to find yourself into such a program, then you want to take it before you even start, because it gets busy. In other programs also, even I know people who have graduated from residency before taking step 3. So, but one thing for sure is that you must take step 3 before you can write the boards. For sure, you must take step 3 before you can write the boards. So. Yeah, you are welcome. And if you are just joining us, we are just talking about, as the title of the video says, we are just talking about USMLE and then this journey to residency. If you have any questions, you can ask, you can use the link to join as well, and then speak to us. And also, if you can share the link so that more people can join us, it will be good. Share the link also. If you haven't subscribed, please do subscribe. If you have not subscribed, please do subscribe. Hmm. Please subscribe to the channel as well. And if anybody has any other question, I'll be glad to answer. And as I was saying, like, one thing that a lot of people don't know is after residency, you need to be board certified, right? One, before we take the boards, like every year in residency, we take in training exam. It's called the ITE, and this tests your readiness for the boards and also tracks your learning trajectory through residency, so that they want to be seeing an increase in your scores from PGY1 to PGY2 to PGY3. That shows that you are learning and your knowledge is climbing up. So that's one thing a lot of people don't know that we do whilst we're in residency. Another thing that people don't know is that they don't know that we take the boards, like I'm in internal medicine, so we take the board of internal medicine right after residency, and after every 10 years you have to take it all over again, and after every 2 years also you have to renew your license. So that's what people don't know. So the fact that you have graduated from medicine, does not, or residency, does not mean that you don't have academic works to do. You still have to keep up with current practice guidelines so that you can pass your boards in the next 10 years. It's like that. So the journey never ends. Kindly share the link to your friends. Tell them that USMLE Booster is back. I'm back to guide people. Kindly share the link. And also like the video. Let's go to the next question. Yeah, I'm applying without US LOR. What do you advise? Go ahead and apply, but do not apply without any LOR. Make sure you have an LOR to apply. Don't apply without an LOR. So it doesn't necessarily have to be from the US, but if it's from the US, it's it's holds stronger advantage. But if it's not from the US, still put something there and get that letter from reputable um, doctors from your home country. Um, so it doesn't really have to be just doctors from the US who should write your LOR for you. And I wish you all the best. I wish you all the best. And just make sure you are strategic when you are sending your applications out. Um, and I'll see the next question. Yeah, feel free to join us. Use the link to join the live chat, to join the video chat. Use the link to join us. Okay, you can click on the link, the stream yard, and you can communicate with us. You can talk with us, and we'll hear your voice. Okay, and use the link, and we can hear your voice. I'll let you in as a guest on the show. Okay. Um, let me see. Next question is saying that is it likely for an IMG to get surgical discipline in residency? Yeah, it is. It is possible. Some have done it, but most of the people I know who have done it came to the US to practice with or have clinical experience with some surgeons here in the US. It's not impossible. Some IMGs have done it, so it is very possible. It's something good to try. When I started, I was also looking at surgery, but later on, when I got to the time to apply, and then I didn't have a lot of time, and I didn't have the energy anymore to even pursue surgery. I didn't have the energy to stay home one more year to find a surgical discipline, to do my clinical experience with, or to find someone who will really take me. I was just tired. I was just tired. So I decided, you know what, like I don't have to necessarily be a surgeon because it's really stressful. It's 7 years of studies, right? Yeah, 7 years of surgical residency. And first, most of the programs they'll have to do 4 years of general surgery. Then they'll now do specific surgeries. Yeah, do not have to do either fellowship in specific surgical discipline. So it's really stressful. I didn't think I had the strength to go to another 4 years. I don't think I have the age on my side. Yeah, so it's possible to match. Um, I hope I answered your question. Let me know. Um, can we get more likes on the video, please? More likes, more shares. Can someone share the video? And can you also subscribe to the channel? That would be helpful. You can also subscribe and share this video with other people as well. Um, what else haven't we talked about? So we have done 2 hours already. If you have any more questions, you can put it in the comments and hopefully I'll be able to answer them. Um, um, Okay, cool. If we don't have any further questions, then we would be ending it here. It's all right. We have a question here. If I take $100,000 to pay for accommodation, school, and exam preparation, will it be enough? I'm trying to save money for this project. Um, so are you still a medical student? Are you now going to start a medical school? Or are you an IMG already? Can you let us know? I think that's interesting. But basically, this process shouldn't take that much of money. It shouldn't take that much of money, and also I would not advise people to save money before they start the process. The most important thing is to study. So if you can get the materials you want to study before you look for money to register for the exams. You want to be prepared for the exam before you register for it. So do not save money before you start. Start learning, and then as you are learning, you when you feel like you are almost ready, then you get some money to register for the exam and learn towards the end and go take it. Um, you don't have to move to the USA. Hmm. Did I just see? Yeah, you don't have to necessarily move to the USA before taking this exam. It doesn't work that way. You don't have to move to the USA before you sit for this exam. Yeah. Oh my God, can you all see this? This is so cool. When I do my thumb like this, it comes on the video. Okay, that's so cool. Um, so yeah, you don't have to like save money before you start this process, honestly. Yeah, it's this journey is not about money. It's not about money. Money shouldn't be a limitation. And $100,000 is just too much. Unless you're about to start medical school at fresh and all that, then I would say so. But if it's just steps, then $100,000 is way too much. Um, can we do USC in clinics and get LR? Of course, you can do it in clinic. Clinic is acceptable. And most hospitals will not let you go into the hospital to take care of patients unless you are doing it through your medical school and also you are going to have a malpractice insurance. So clinic is the way to go, especially for internal medicine and family medicine. Clinic is the way to go. Okay, so um, all right, let's come to this one. I'm going to do this again. This is so cool. Let's see if it comes. Yeah, do you see it? Do you all see it? It's so cool. Let me do it again. Let me do two thumbs and see if all two will come. Oh, really? I didn't know this, guys. Did you all know that if I do my two thumbs like this, it's come, see the background? Yay! How about if I do this? Sorry, I'm exposing my ignorance because I don't have any time for, for technology. I believe if you're on TikTok, you know more about this. I don't have TikTok. So if I do one hand, what happens? Guys, I'm just happy. Oh, really? Sorry, guys. Sorry, guys. I didn't know all this. Just finding out. So I was just trying to scratch my neck and my lips, and then I saw that it popped up, and I'm like, let me do it again and see, and it came right. Yeah. Like, what if I do this? Woo. Okay. Then I did this. Let me do right hand rule and see. It didn't show anything. Oh, it also showed something. What else should I do if I do this? But if I do this, okay, guys. Okay, that was just by the way. That's me playing. All right, let's go to the next question. So the next person is saying that it seems many candidates applying to IM have 250 plus a step two scores. Please, do you think it is possible with a 230? It is possible. You just have to find a program that would accept you. So look for the programs who do not care so much about scores. Some programs want 220. All you need is an interview, right? So some programs want 220. Find those programs by using the link that I put out there. It's called Match a Resident. Put in your scores and it will tell you which programs will accept your score. Then you can apply to those programs. Okay, so it's possible. Nothing is impossible. Okay, it is possible. Can we get more likes on this video, guys? And please share this video. I know you can share it with your friends. Okay, share with your friends so that we can get more people to watch this video the next time. And I'll come to you all within the week again. Um, if there are no further questions, we might have to end it here. It's been good talking with all of you, and good luck to everybody. Let me do this again. Yay, good luck to everybody. Good luck, guys. Yeah. Good luck, everybody. If you have not subscribed, please subscribe and share with your friends so they can also subscribe. And I'll come to you again within the week. Okay, I have today off, so I'm just going to rest, take a rest, and go and continue tomorrow. All right, bye, everybody. Bye. Thank you. Thank you, guys. Thank you so much for joining. Thank you so much for joining. Bye. Bye, everybody. Y'all have a good day, and I wish you all the best. All the best to everybody. All the best to everybody. Bye. If I do this, just one. I like this one, and this is also good. What's the easiest state to do internship? This one is a hard one. this is a hard one. Honestly, it's a hard one. I don't have specific information about that. I'm sorry. The easiest state, because the states are big. I've not been to a lot of states. There are a lot of states I've not been to. Um, a lot of states I've not been to, so I wouldn't be able to know. Um, but I think the best places to do, Maryland is for sure one of them. Texas is another one. That you can do. New York is also another one that has a lot of hospitals. So those ones I know. I know IMGs go there to do their internship. So all right, guys, I'll leave all of you here, and then you all have a great, wonderful, wonderful day, and I'll see y'all in the future videos.